What a wonderful introduction. I'm not sure I recognize that person. It's interesting to look out amongst all of you young, it's painful to say it, young medical students here at Sinai. I can only give you a couple warnings. First of all, you young men, you'll never see that tie again for the next 4 years. And the second is a deep, grave warning. When I was in this seat in the first year, I had a full head of hair. Not so at the fourth year. I am Dr. Michael Marin, your chairman of the Department of Surgery of your medical school. How does that sound? Your medical school. Taking ownership of this institution, your institution, begins today with all the perks and responsibilities. I'm so pleased to have the opportunity to speak to you today, and it's not a surprise. Think of yourselves in my shoes, being able to come back and speak at your alma mater at this important ceremony. It's really a great thrill. This is indeed the white coat ceremony, and perhaps one of the most exciting and most symbolic things in the beginning of your career as a young doctor. A day to remember like no other day, but perhaps akin to some of the things that you've experienced over the past few years. That moment when you received your acceptance to your undergraduate choice school, when you got the Mount Sinai acceptance, which was clearly all of your first choice. Or maybe that monumental day when your parents gave you the keys to the car for the first time so you can drive independently around your neighborhood if you're from Long Island or Westchester, or gave you a shotgun if you're from Tennessee. But this truly is a very special day in your career. In just a few moments, you will slip on your very first white coat. When you do so, I want you all to stop and savor the moment. There are moments like this, and they come and go quickly, and we ignore them. Don't ignore this one. Put it on, feel it. It's a new coat. Clean, white, important. Savor that moment, because it's going to mean a lot to you today and in many years to come. I suspect that before this ceremony today, many of you consulted the top medical information authority, Wikipedia, to get some quick information about what the white coat ceremony is all about. Invariably, you already know that your new coat is going to be white, not chartreuse or some other color. And this white color can be credited to the professional customs that were in effect around the turn of the 19th century. But doctors didn't always wear white coats. There was a time when black coats were in fashion. Black coats denoted an air of formality, distance, and they hid the dirt and grime of everyday medical practice quite efficiently, I would suspect. There was no washing these heavy wool white coats in hot water or bleach, so the sterility and cleanliness was clearly a compromise. White, on the other hand, as it became popular, denoted and permitted the cleanliness as we began to understand about antisepsis and bacteria. Purity, professionalism, and trust. A move from the dark and formal to the light and pure. Evidence to support this historic change leads us to the famous Thomas Eakins painting created at the Jefferson Medical College in 1875 entitled The Gross Clinic. You've all seen it on the cover of textbooks, or perhaps the hubbub around it as it went into its first major cleaning in its history. In this famous painting, everyone wears black as Dr. Gross, this has nothing to do with a gross picture, as Dr. Gross operates upon the diseased leg of his patient. The operating theater is cold, dark, formal. By the turn of the century, things change. The year is now 1899, and Thomas Eakins is once again in front of his easel, working at the University of Pennsylvania and painting the Agnew Clinic. In this painting, everyone, you guessed it, is dressed in white. White coats, white gowns, long ones, short ones, white outfits of all sorts, defining our profession, a cloak of compassion, and a symbol of the times denoting the caring and hope that our patients expect to receive from each and every one of you, their physician. The expectations of the white coat are enormous and undoubtedly already evident to you all. This privilege to enter the deepest, most private and tender regions of our patients' and their families' lives come with great responsibility and in turn deliver great satisfaction. And the professional satisfaction that you will receive is indeed one of the greatest gifts you will ever get in your life. Now, I understand this is the white coat ceremony, but why must we dwell on the white coat? Wikipedia does a fine job with explanations of purpose. What I really want to talk about is that shiny new stethoscope you're also going to receive very shortly. You will indeed soon be cradling this nice, shiny, wonderful thing in your hand. Some of you will immediately put it around your neck where it will remain for 4 years, creating a permanent dent in the back of your neck. However you choose to carry your new stethoscope, you will come to know just how important this device is to you today and for the rest of your professional career. Invented in Paris in 1860 at a time when medicine was barely credible in the eyes of most historians, this innovation immediately accomplished at least 2 important functions: auscultation, or listening to the sounds of the internal parts of your body, and bringing us close to our patients. Bringing us close to our patients and listening. To properly use this new gift that you will fondle in your hands, you need to get close and you need to listen. The key to your success as you embark on your medical education over the next 4 years and for the rest of your professional life is you need to become good listeners. This may sound trivial, but it would shock you to know how poor most of us do this simple task in our personal and our professional lives. We need to listen to the doctors, the nurses, the x-ray technicians, and all of the members of our healthcare team to do a good job. You need to listen to each other. You'll be amazed how much you will be teaching each other. And you need to listen to your patients. And to serve your patients well, you need to listen and learn from your professors, your teachers. Listen to your Mount Sinai teachers. They will be your guides and mentors as you enter the most innovative time in medicine, and certainly one of the most innovative times at Mount Sinai. And what extraordinary teachers and guides they will be. 100 years ago at Mount Sinai, the teacher, Dr. Leo Berger, first described the disease that bears his name, Berger's disease. Berger's disease destroys the small arteries of the limbs and renders patients with gangrene and the risk of loss of limb. That was 100 years ago. Today at Mount Sinai, Drs. Fayed and Fuster have developed a new technique to image this disease and guide treatment. Dr. Fayed and Fuster are going to be your professors and teachers. Listen to them and learn to innovate. 80 years ago, Dr. John Garlock, a Mount Sinai surgeon and teacher, performed the first successful removal of a cancerous esophagus in a surgically open chest in a patient. Today at Mount Sinai, Dr. Sharmila Anandapathy developed techniques to remove such cancerous lesions through a patient's mouth without ever opening the chest. Dr. Anandasapapathy will soon be your professor and your teacher. Listen to her and learn to innovate. 70 years ago, a Mount Sinai doctor and teacher was the first to describe an inflammation of the intestines that bears his name, Crohn's disease. Today at Mount Sinai, scientists and their collaborators have identified 5 new genetic mutations associated with Crohn's disease that gives us a step closer to actually curing this devastating and complex problem. These Mount Sinai doctors and scientists are going to be your professors and teachers. Listen to them and learn to innovate. 40 years ago, Mount Sinai doctors were the first to prove for the entire world that asbestos not only can but will cause cancer. Fast forward to today, a Mount Sinai professor and teacher, Dr. Raja Flores, has developed techniques to remove those asbestos-caused cancers and give a chance for cure. Dr. Raja Flores will soon be your professor and teacher. Listen to him and learn to innovate. 25 years ago, a Mount Sinai doctor for the first time identified certain chemicals in the brain that were involved in causing the devastating disease schizophrenia. This discovery paved the way for more successful drug treatments for this disease. Today at Mount Sinai, the scientists who are discovering these genes and discovering ways of treating this disease will soon be your professors. Listen to them and learn to innovate. Innovation is in the blood of your medical school. When I graduated from Mount Sinai, the responsibility to innovate for the good of my patients was not a concept, it was a mandate, and that same mandate is being placed to you today as you don that white coat. 3 months after I finished my training as a vascular surgeon, I was asked to care for a sick 89-year-old man who had sustained a very serious myocardial infarction. He had a 9-centimeter abdominal aortic aneurysm, which is a growth or enlargement of the aortic wall, the main artery of the body, which renders it weak and risk of rupture. Left untreated, this problem would take his life. The risk of conventional surgery was overwhelming and prohibited survival, and he would not survive that surgery. The drive for innovation immediately led me to invent, build, and perform the first minimally invasive repair of an aortic aneurysm in this country. My patient lived for 4 years, during which time he had the joy of seeing the birth of 4 great-grandchildren and marrying his 3rd wife at the age of 90. The power of innovation. Our dean, Professor Charney, once said, and I quote, "An outstanding doctor can care for and make a difference in the lives of perhaps 1,000 patients in her or his career. That's wonderful. But an innovative, outstanding doctor can change the course of a profession and impact millions of lives in a career. That's truly extraordinary." End quote. Over 100 years ago, Mount Sinai doctors and scientists were the world leaders innovating and defining the future of medicine. Today, your Mount Sinai professors have taken control of groundbreaking medical innovation by day and serve as your teachers by night. From our many landmark discoveries unraveling the genetics and genomics of disease, the clinical innovations with surgical robots, transplantation, and vascular stents, you are now part of one of the most exciting and innovative times in the history of Mount Sinai's 150 years. A big part of the future of medicine lies in your ability to innovate. Do so and secure your patients and our profession's future. So, as soon as you are handed that shiny new stethoscope, don't put it around your neck. It'll define you as an internist, and I really don't want to see that. Take it out of the box and start to think, learn, innovate, and most importantly, I want you to begin to really listen. I look forward to working with each and every one of you over the next 4 years as you work your way through the clinics and the basic science parts of your education. And it's a great honor to see you here today, and I'm very proud of each and every one of you. I want to extend a special thanks to the families in the back, parents, loved ones, caretakers. Without you, this would not be possible, both financially and emotionally. I certainly know it. My daughter is in the 3rd year.